Greetings, everyone. Welcome to another Under the Microscope session. Today, we're going to look at some of the common errors. So we're going to do an error correction session. Should be a lot of fun. Should help you, should create awareness of the common errors that occur in the writing subtest. Let's see who's joining us. I'm broadcasting out of Brisbane. It's July 19, just gone 8 a.m. A big hello to everyone, wherever in the world you may be. And just type in your location. I can see we have people from India. Welcome to India. Lots of people coming in. I'll try to answer your questions as we go along. We can start off with Dr. Pfizer. Dr. Pfizer says, I have an issue with writing. I misinterpret most notes most of the time. What to do to fix it? I guess that's a reading skill. So even though the writing subtest is writing, it involves reading. You know, it's a language test. So my suggestion to you is read as many case notes as you can, compare with the model letter. And the more you do that, the better you'll get. Just takes time. Because obviously that's important because you are assessed on content. It's a great first question. Hello to Sri Lanka and Nigeria. Libya is here. Welcome to Saudi and the Philippines. Bolivia and Kenya. Excellent. Hello to Ghana and Ireland and Zambia. Italy, Canada, UK, Pakistan, Morocco. People from all over the world. That is wonderful. Hello to Spain. All right, so I've got my chats going, everyone. I'll just make sure I can see them all. Hello to Iraq. Summertime in the Northern Hemisphere, whereas it's winter here. I'll just bring up my Facebook lastly. Italy, Canada, UK. All right, I think I've got all my social medias ready. All right, hello to Egypt as well. All right, let's get cracking, everyone. We've got a fair bit to get through and not a lot of time. I will try to answer questions as they come, but let us begin. So I'm going to break this down. We're going to look at common errors. We're going to go through articles, prepositions, verb use, sentence structure, and vocabulary and word form. So let's just look at some of these sentences and feel free to engage in the chat and make any comments that come to mind. And I'll try to respond to those as well. All right, here we go. So starting with articles. Look, articles, remember you're looking at case notes here, and the case notes have the articles removed. So you're not going to see many articles at all. So it is your job, you know, like the instructions, expand on the case notes. That's an OET task 101, expand on the case notes. That means putting in articles, putting in prepositions, putting in verbs and helping verbs, putting in punctuation. All of these things are things you need to do. So, and that's where we see a lot of errors, right? So, number one, the patient has tender right elbow joint. Perhaps you can see that error there, everyone. The patient has tender right elbow joint. Now, the issue is this word joint. Joint is a countable noun. We have many joints. So to fix that, we need to say the patient has a tender right elbow joint. Pretty simple, isn't it? But you won't see that in the case notes. Have a look at number two. John had ache in his lower back. Now, ache's an interesting word. John had ache. The first question we have to ask is ache countable or uncountable? And actually, it's a countable noun. We could have multiple aches. So we need to say John had and ache in his lower back. All right. But pain is different. The patient has a pain in her left shoulder, but pain's the opposite. It's an uncountable noun. So if you're just getting the hang of OET and you're learning the basic rules, these are the things you need to know. So with pain, we do not use an article. So ache and pain are different. Next one. Mrs. Stewart is an 83 years old woman with 3 years history of dementia. Quite a few errors in this sentence, and we need to fix these, right? So again, 83, so that's phonetic, isn't it? Begins with an E. So the way it sounds is the way guides the rules that we need to apply. So again, Mrs. Stewart is an 83. Now, this is a common error. Many of you will know this one now. We don't really want to put the S there, do we? Is an 83-year-old, and we remove this. So just remember that we can say she is 83 years old. We're describing her. She's 83 years old. As soon as you put the noun on the end, it's functioning as an adjective. We're describing a woman, an 83-year-old woman, and we don't pluralize adjectives. So it's an important one to remember. And the same thing is happening here. With 3 years history, no. We've got to put the rules. A 3-year history of dementia. So you've got to learn those patterns. Preferably, we'll put a hyphen in here as well. A 3-year history of dementia. And last one, Mr. Jones underwent a surgery in 2020. Now, surgery is a little bit like joint. It's the opposite of joint. It is an uncountable noun. So Mr. Jones underwent surgery in 2020. So your job as a writer is to know when to include articles for countable nouns and when to leave them out. For example, in this sentence, I could write, Mr. Jones underwent an operation in 2020. Operation is countable. So these are fairly basic ones, but you know, articles are not that basic. You know, articles are one of those things in language that it's tough because there are so many rules. So number one for you guys watching, make sure to write with control and accuracy, you need to be strong with articles. Now I'm keeping my eye out for questions as they come through. Should we add O before numbers till 9? Or should we add, not sure what you mean, Nijas. Dr. Fisa says the difference between pain and ache, well, really, they're used in slightly different ways, but we say aches and pains, they have the same meaning, but there's certain collocation, certain, we don't say lower back ache usually, we'll say lower back pain. So you just have to be familiar with where these words are used, and you get that by reading and listening and building that awareness. But in the basic form, ache is uncountable. Ache is countable, pain is uncountable, and surgery is uncountable, whereas operation is countable. All right. Now I'll move on to prepositions, everyone. Prepositions. Also, you won't see many prepositions in the case notes. They tend to be removed. So it's your job to add them. Let's have a look at this first sentence here, everyone. Mr. Stumble was admitted in hospital in 2009-2021 after he fell from the stairs in home. Well, we got multiple errors here, everyone. Can you see the errors? Mr. Stumble was admitted in. There's our first one, isn't it? Was admitted in. It's a common one. Now, we don't admit in, we admit to. So was admitted. This is just memory. And that's collocation with the verb. Was admitted to hospital. This is in. No, this is also wrong. In for dates, isn't it? So it's a particular day of the month. So what preposition do we use? I'm sure you know. On 20/09/21, after he fell from the stairs. Now, this is an interesting one. Fell from the stairs. Can anyone give me a better suggestion for from? From's not really good here. From means you actually going from the stairs onto the ground, but we tend not to fall from the stairs. What do we do? I'll see if anyone can get this one. It's a tricky one. Yep, someone got at home. Yes, fell from stairs. I agree with that one. Fell from stairs at home, not in home. But what about instead of from? Can anyone get that? Over, no. Off, no, you don't fall off stairs. Think about this motion. Think about that motion. I suppose you could fall on the stairs, but not normally. Yes, Khadija got it. Well done. After he fell. Look, this is most common. After he fell down the stairs. I mean, you can also fall up the stairs, but it's just less common. People normally fall when walking down the stairs. Very common injury, isn't it, everyone? You'll twist your ankle, or you could have a head injury. Lots of things could happen when you're walking down the stairs. So meaning changes with prepositions. All right, some of these next ones you'll know. Miss Green has a bruise. That's good article. Bruise is countable. In her left shoulder. Should the bruise be in her left shoulder? I'll let you think about that. The patient requested for an early discharge. Mr. Jones attended to the clinic yesterday. John has severe pain on his lower back. So we have to think about these words. Yeah, people are going on. Yeah, the bruise isn't in the shoulder. It's on the shoulder. The patient requested for. We don't need for because that's verb. You request something. You don't request. You can make a request for something, but as a verb form, the patient requested an early discharge. A lot of people make that error where they put prepositions where they're not required. That's also confusing. Mr. Jones attended to the clinic yesterday. Well, we've created a new meaning. If you attend to something, you attend to the patient. You care for the patient, right? But no preposition required. Mr. Jones attended the clinic yesterday. We're changing meaning. John has severe pain on his lower back. Well, pain is internal, isn't it, everyone? So the pain is in the lower back. All right. Now, prepositions is one of those challenging areas of language. It's like articles. You've got to know the rules. You've got to practice. So if you find this challenging, definitely spend a bit of time. And I think it's really awareness. And even when you sit the exam, when you're doing your proofreading, you've got to double check. And I think these errors are really common for OET because you have to expand on the case notes. So number one, articles and prepositions have been removed. And number two, you're describing parts of the body and medical conditions. So prepositions are very common and necessary to do that. You need to have good control. All right. So that's the basics, prepositions and articles. Now let's talk about verb use. Again, we're just going through, I've just selected 5 common errors for each section. And just remember, these errors are real. This is data that we collect from our students. So they're real errors that people make. And one thing we know, language learners tend to make the same errors, and even certain people from certain cultural backgrounds or first languages make the same type of errors as other people from that same background. So there's definite trends that we can pick up as teachers. And that really informs us when we teach, because we can pinpoint and predict the kind of errors that you guys make. And we design our courses accordingly with worksheets and videos and classes to help you reduce those common errors. All right, verb use. The patient was diagnosed hypothyroidism since 2010. Now we got to, I'm going to put we're missing a preposition, so let's put that in, was diagnosed with. But something's wrong here. Can you see it, everyone? So we've got was diagnosed, which is our verb tense, and we've got since 2020, which is our time marker. Now, those two things aren't in alignment, right? So we need to be able to fix that. There's 2 ways we can fix that. Yeah, something wrong with since, that's right, Shanmuga. Something's wrong with since. Yeah, if we're going to use since, we really should say has been diagnosed with, right? Or we're going to do something a little bit different, aren't we? We can copy and paste this one. Whoopsie. The patient was diagnosed. And if we put with, and then we'll change this to in for the year, right? So these are the corrected versions, everyone. So it's 101 OET. You have to know the difference between present perfect to describe something that's happened over time, and simple past, which focuses on the actual diagnosis date. All right, so that's how we fix it. So remember, your verbs and your time markers need to be in alignment, right? It can get pretty tricky and requires that awareness, because if you make verb tense errors, it's very confusing when you're summarizing a patient's timeline. Okay, number 2, for the past week, she has been taken paracetamol for her pain. For the past week, she has been taken. Ooh, that's not right, is it? For the past week, she has been taken. How do we fix it? And while I'm waiting, Mohammed says, can we say she's been suffering from hypothyroidism? Look, it is possible to use suffering, but you've got to ask yourself as a health professional, are they really suffering? Is it well managed? If it's well managed, we often say not suffering from diabetes if it's well managed. So suffering implies some sort of pain or discomfort. So that's how you make a decision on that. Often you could, I think it's quite, it's a bit more effective if you say she has a history of hypothyroidism rather than suffering. But if someone has pain, the patient presented today, suffering from a 3-week history of headaches or something, I mean, you are suffering. So the word isn't taboo, but you have to think about when you use it. All right, everyone's going, was taking, yes, for the past week. No, I wouldn't say for the past week she was taking, because we're going for the past week. So that's giving us present perfect. So it's an action here. Indawari got it. So did Senior. Yes, she has been taking paracetamol for her pain. Right? It's a regular action. For the past week, she has been taking. You could say she has taken, still present perfect, that would work. But the progressive form is a little bit better because it indicates that repeated action there. All right, next one, number 3. She has underwent heart surgery on 10 of August 2022. She has underwent. Now, this is a bit of a problem. We've used present perfect, but it doesn't really work. She has underwent. And while I'm waiting, as Dr. Fiza asked, can we say suffering for symptoms? Yes, I think for symptoms, that's a good way to summarize it. For example, pain, headaches, colic, things that really cause some sort of difficulty, I would say it's acceptable. Yes, she underwent. Yes, so we're just going to use simple past. She underwent heart surgery on this date. We must use simple past. Right, number 4, Paul has been having cystic fibrosis since birth. Ooh, can you spot the error there? Paul has been having. Can we use having in the ing? I'm having a headache. Does that sound good to you? Southern writes on the previous one, she has been underwent. No, that's just underwent there because she is the subject. So it's an active, not a passive. Yeah, I like that one. Thank you, LJQ. Has had. Yep. Or has. Yep. I think that's what I would use. Has had cystic fibrosis since birth, because the word have is a stative verb, right? So we don't want to use ing with stative verbs. There's lots of verbs, stative verbs, like know, I am knowing you, no, I know you, or feeling, I feel unwell. There's lots of ones like that. But just be aware that it's a stative verb. Do not use the ing there. Now we're going to use a passive active. A liver cancer was confirmed a 10-centimeter abscess. Can you spot the error here? A liver scan was confirmed a 10-centimeter liver abscess. Looking at your answers coming through. A liver cancer was confirmed. This is tricky. We've got to think about our subject here. Confirmed, yes, without was. Thank you, Danielle. A liver scan confirmed a 10-centimeter liver abscess, or we can just change the subject. A liver abscess was confirmed by a liver scan or ultrasound. And you can put the details here. 10-centimeter liver abscess. So your job, and now we're going to use was confirmed, now it's correct, but your job as a writer, you need to think about what your subject is. When we're talking passive or active, you've got to have that awareness to know what your subject is and whether it's followed by a passive structure or an active structure. And you do that by looking at your subject of the sentence, all right? And of course, verb use errors cause confusion. How many verb use errors can you make in an OET writing and still get your required score? as little as possible is my advice. Once you start making multiple verb use errors in your letter, it's really going to drag your score down, because describing a patient's history accurately is so important. So a very important job as writers is to get confident with verb use. That comes through practice. Someone asked, Victor says, can we say diagnosed of? No, Victor, diagnosed with. You're mixing up with the patient has a diagnosis of. I'll show you that one. Mr. X has a diagnosis of hypothyroidism. So you can see the difference with the noun, diagnosis of, with the verb, diagnosed with. Vocabulary building. All right, let's have a look at sentence structure, everyone. In terms of Mary's rehabilitation, dressing of the wound is required and should not do impact activities. Can you spot it? This is a very common error. In terms of Mary's rehabilitation, dressing of the wound is required and should not do impact activities. So we've got our adverbial phrase. Oh, in terms of, maybe that's an error, isn't it? In terms of, there's one. In terms of Mary's rehabilitation. Otherwise, that's our adverbial phrase, giving us the topic of the sentence. Dressing of the wound is required, good, and should not do impact activities. Oh, Razie has got it, should not do. So what can we put here, everyone? What's the missing word? We're missing a subject there, aren't we? Anyone know? Good, Cosmos, in terms of. Good, Abdul Razak, impact activities should be avoided. Nice. And Saha got it, and she should not do. This is one of the most common errors that we see as teachers. Missing, it's a compound sentence, but the subject of the first clause is dressing of the wound, but the second clause is different. So we need to add it. Very, very common error. Okay, look at this one. Despite of the treatment, he had intermittent nausea, muscle pain, as well as he had swollen joints. Now, there's a few errors here, a few common ones. Despite of the treatment, he had intermittent nausea, muscle pain, as well as he had swollen joints. I wonder what you're seeing. Yep, I think some people are starting to see it. What should be avoided, Mercedita? He had is okay. People are still looking. Oh, Surus, as well as, yes, you're getting it there. Cancel he had. Yes. So we'll work our way through. Well, this is one, definitely. People have picked up on that. Yes, as well as. So as well as plus noun, right? I'll talk about that in a moment. I'll see what else we get. Yes, despite. Thank you, Rashika. Yes. So we can't say despite of, despite the treatment. We can say in spite of, but despite the treatment, despite plus noun, or despite plus gerund, which is the ing, despite having treatment, despite undergoing treatment, right? He had intermittent nausea, muscle pain. He had intermittent nausea, muscle pain as well. I would probably, if I'm correcting, I would say he had intermittent nausea and muscle pain. And then I would add, so I'd put and here, as well as plus noun, as well as swollen joints. So certain words like despite, due to, as well as. Now these words plus the ing or plus noun. That's the rule. But what people tend to do is they want to put a clause, a full clause with a subject, verb, object. No, we don't do that. We just put a noun. And that's why these words are very useful in OET writing, because it means we can write with a little bit more clarity and conciseness, but we need to know the rules associated with these words. All right, let's try the next one. Mrs. Conway presented on this date complaining of unable to conceive for 18 months. So we got complaining of. Mrs. Conway presented on this date complaining of unable to. Can anyone work out what sort of word goes in here? Mrs. Conway presented on this date complaining of. So you complain of something. So it has to be a noun or a gerund. The tricky one. Ooh, 76 got it. Yes, well done. Of, complained of being unable to conceive. Now you could also say complained of. There's another option. And inability to conceive. Complained of an inability. So we're following the of this preposition with a gerund or a noun. That's grammatical awareness. Keep going. What about, this is a very common one as well, number 4. Although he was in considerable pain, he refused to take analgesics. Although he was in considerable pain, he refused to take analgesics. Omar says for the previous one, can it be incapability? No. Inability is better in this sense. Someone asked, is an necessary? Yes, complained of an inability because it's functioning there. You know, we can have multiple abilities, inabilities. So an article is preferred there, Victor. Yes, comma placement. Thank you, Jaxie. Comma in the wrong place. Although he was in considerable pain, he refused to take analgesics. So do not put a comma after although. Although is a subordinating conjunction. It's different to however, therefore, has a different rule. So for this one, it's used to join to a dependent clause, which is attached to a dependent clause. So independent clause. So this is our dependent clause, and it must be attached to green, which is our independent clause. And we put a comma to separate the two when we start with the dependent clause. Make sure you know your complex sentences, dependent and independent clauses. Last one, 5. Also, I have requested further blood investigations. Again, a very common error. And it's to do with the placement of also. It doesn't belong here. Where would you put it, everyone? Where would you put also? Also, I have requested further blood investigations. No, not so much a comma error there. Oh, Jelly Rose got it. Well done. Yes, I have. So after the auxiliary verb have, I have also requested, but before the main action verb request, I've also requested further blood investigations. So you have to know where to put also after the auxiliary verb, before the main verb, because it just doesn't belong Also is a great word when you're adding extra information, but don't use it to start a sentence. Okay, last ones we're going to look at, and this is a bit word choice, vocabulary, and meaning. These ones are a little bit different. They're not all grammatical errors per se. They're just using words that don't really belong in a referral letter. So the first one, Ms. Rose is divorced and lives on her own. What do you think, everyone? Miss Rose is divorced and lives on her own. Can you see anything wrong there? While I'm waiting, number 2, osteoarthritis is a common condition among old people. Can you see anything wrong with that one? Number 3, the medication needs to be taken thrice a day after meals. Something's not right. If you know the reason, say why. Number 4, she's a non-smoker and non-alcoholic. Something's wrong. She was advised to drink a good amount of water. Yes, some people are saying single. Yeah, but do we really want to say she's single even? The tricky one, isn't it? Yeah, answers are coming through. The bottom line is you don't really want to, divorced. There's a bit of a social stigma there. It can sound judgmental. And as health professionals, yeah, Shamuga got it. You don't really want to say something like that. So I just leave it out unless it's causing depression or psychological illnesses. Maybe you're writing to a psychiatrist, mental health worker, where in certain cases it could be necessary information. But if she's just got a medical condition, maybe we just say Mrs. Rose lives on her own. And we don't know, maybe Anne has minimal social support. You don't know that if the case notes say that, if she doesn't have anyone supporting her. But for example, but don't use those sorts of terms. Leave it out, not mentioned. Osteoarthritis is a common condition among old people, not old. Someone said older people, no. Oh, elderly getting closer. Different answers coming through. Yes, elderly is said by Sura. Yes, among. And we'll normally say the elderly as a group of people, among the elderly. It's more respectful. Old people, it sounds a bit, a bit informal, lacking a little bit of respect there. As health professionals, you're professionals. You have to show respect. LJQ says aged, among the aged, possible. 76 says elder people, no. Older adults, in some circumstances in Dewari, that's good. All right, next one, thrice a day. No, we can say once, we can say twice, but thrice is old-fashioned. Don't use it. The medication needs to be taken. What do we put? Omar got it. 3 times, just add an S, 3 times a day. Once, twice, 3 times. All right. Thrice is not informal. It's more old-fashioned, used less commonly in standard English. It may be in your version of English, but you need part of the process if you're already an excellent speaker, as I know many of you are, but perhaps your version of English is not the standard one used in your target country, whether it be USA, UK, or Australia, New Zealand, or Canada. So you need to stick to those standards. She's a non-smoker and non-alcoholic. Now, this one's a tricky one. We can say non-smoker, but what about, Can we say non-alcoholic? Is that right? What is an alcoholic? Yeah, Omar, not an alcoholic. What word can we use? She's a non-smoker and there's another word we can use. Anyone get it? Neither alcoholic? No, we won't use that. A person who doesn't drink is a what's the word? Chamuga, she doesn't smoke and consume. No, she doesn't smoke or consume alcohol. You could say alcohol drinker, Jelly Rose. That's good. A bit more simple, though. She's a non-smoker and Oh, Katerina got it. Well done. She's a non-smoker and non-drinker. Full stop. Basically, don't use the word alcoholic in your case notes. It doesn't really have a place. An alcoholic is someone who is addicted to alcohol, right? Teetotal is a great word, Evelyn, but it's a little bit informal. Binge drinker, just a different meaning there, Mercedita. Simply non-drinker in this case. But I would avoid alcoholics, definitely judgmental. And unless the case notes specifically say it, you really shouldn't mention it. All right? You can say heavy drinker, or you can even point out the actual consumption, or a social drinker, occasional drinker. All right, last one. She was advised to drink a good amount of water. She was advised to drink a good amount of water. This is a spelling error. And this is a bit informal, a good amount. You know, that's more like spoken English. Oh, good job, Caddy. I would definitely use that. She was advised to increase her fluid intake. So you need to sound like a health professional. And just having that vocabulary range. But did anyone spot the other error? Oh, Bernice did. Diana and Minin did. Farm did as well. Yeah, Pfizer and Zara, well done. Senior, lots of people got that one. She was advised. That's a fatal spelling error, that one. It might look like a spelling error to you, but in the eyes of the examiner, it's really a vocabulary error. Causes confusion. Okay, and there we have it, everyone. Those are just very common errors. Now you could imagine we could spend hours on this topic. There are lots of them, but your job is just to build that awareness over time and practice. Perhaps you've got your teacher there giving you expert feedback. At OET Online, we also have expert writing courses and teachers who can give you very detailed feedback, which is very clear and easy to follow, because at the end of the day, you need to be able to write with control and accuracy. All right. Well, we are done, everyone. Thank you very much for coming along today. I hope you found this useful. I'm just checking on the chat. Good to see some familiar faces here. Tin wants to know if it's live or recorded. Well, for you, Tin, it's live because you're here. But perhaps for other people watching the video, hello, if you're watching the video, it will be recorded. I'm just going to take you to a page, everyone. If you want to know our website, OET Online. We're celebrating 15 years, everyone. We've been teaching OET for 15 years in the online space. So definitely can help you prepare if needed. If you haven't, who's been to our website? Say yes if you've been to our website or if you're already a student at OET Online. If you haven't, I'll give you a link, everyone. Just come along and create an account on our website. It's free to do our free taster course. I'll drop it in for you, everyone. There is just dropping in a link to our website in the chat if you need it. While I'm waiting, question came through from Shamuga. What's the difference between admitted to the hospital and admitted to hospital? With words like hospital, because it's shared knowledge, we all know what a hospital is, we drop the article. So don't say admitted to the, just admitted to hospital. You know, if you want to talk about a specific hospital, was admitted to the hospital in Sydney, for example, or in London, a particular hospital, you could use the definite article. But it's shared knowledge, so we don't use the article there. Good question. Glad it was helpful. Yes, so visit our website, and I'll just quickly show you, everyone. When you come along here, we go back a little bit. Just remember, we have courses for all professions. So, of course, we have medicine and nursing, big range. But even if you're a pharmacist or an OT, a dentist, a physio, or any of the 12 professions, we have courses for you, all the way down to optometry. And we are endorsed by the OET Centre. We have a free taster course. I'll just show you the timetable, everyone. We run twice daily live lectures on our website. Each lecture is 90 minutes long. And whether you're in Europe or Africa, the UK, East Coast of America, West Coast of America, New Zealand, Australia, or the Oceania region, India, Middle East, we've designed timetables that suit all regions. So you'll always find a live class available, can make a real difference, live and interactive. And but all our classes are recorded, and we run 10 classes per week. So that's 15 hours with no repeats of live classes. It's a super way to prepare. They're live and interactive. We have writing classes for nurses only, writing classes for doctors only, and we have writing classes for the allied professions as well. So really good range of courses. You can check out the full range here, All Skills Plus, General All Skills. We did writing today, everyone. If you want to do writing only as well, great range of options there for you. And think about the writing correction service, really wide range of content. You're going to get 5 letters corrected, but you're going to get our grammar and vocabulary clinic, lots of really useful things to make sure you are writing at the required level. Okay. Check it out, everyone. I wish you good progress with your studies. If you've got an exam coming up this weekend, good luck. I'll see you in the next session. When is it, says Olusola? Just check the Facebook or YouTube channel for that. And thanks for coming today. See you in the next session. Bye for now.